Hello, my name is Dr. Agnes Mithamo. I'm a pediatrician working at Nyeri County Referral Hospital looking after children. I'm also a person living disability, having gotten polio when I was a baby. I also belong to the Kenya Pediatric Association, and our theme in that association is Afya ya Watoto Wetu. I also happy to be working with the people in disability in the Nyeri County. Today, I want to talk a little bit about children with disability in our country. In the old days, the main cause of disability was poliomyelitis, and thanks to the vaccines, polio has been eliminated from most countries in the world. But you still have disability in children. Most of the disabilities in children either arises from conditions that they are born with. Some of them get disability due to complications related to birth, and others get disability because of some illnesses they get as they grow up. So when a child develops disability from whatever source, we need to talk to the parents and the caretakers so that we can reassure them and try to support them as much as possible. We also need to guide them on how to attend the rehabilitation services, which can also be found in most of our hospitals, especially the occupational therapy and the physiotherapy, so that we can minimize the severity of the disability that has been acquired. You also need to refer these caretakers to the institutions where they can be taken care of. For instance, if a child even has something like blindness and deafness, you need to refer them to the specialists in that area so that they can get the best possible. In the event that the child develops disability, despite all the interventions have been taken, we need to do our best to educate the parents on how to look after them in their homes, also to educate them on how they can achieve the best rehabilitation possible, and also what can be done to assist that child to have a better life despite the disability. We also need to try our best to see whether these children can get an education. Some can be educated in special institutions, others can be educated in schools where there is integration for people with disabilities, so that they can, because when they get an education, this empowers them to even be able to participate in building the nation and also to fend themselves. And in the event this cannot be possible, then you also need to empower the families, maybe with cash and social support from the country, to ensure that despite the financial problems which will come with this family because of the child with disability, this family is supported financially so that the other children in the family also don't suffer, and so that you can also achieve the best outcome possible for every child in this country.